Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Hello, everyone. Welcome to another edition of the Empowering Plans Podcast. I am your host for today. I am not Ron Peck. It's Brady Bizarro here, hosting for you. And joining me is a special co-host that we haven't had on, I think, ever at the Phia Group. Say hello,
Never.
Mitch.
Hello, everybody. My name's Mitch Hilbert. I have been with the Phia Group a short stint, started March 16th, which, funny enough, was the very first day that it was mandatory for people to work from home due to COVID. So
Wow.
It's been a fun, but at sometimes challenging time, obviously. But everybody here so far at Phia has been fantastic in training me and getting me to where I am today in my new role in the provider relations sector, doing balanced billing.
That's great. You started on the day that we shut the office down. I remember that day back in March. It feels like it was yesterday. We're now at the end of the year somehow, but what a time to start.
Yes, it was quite interesting going into the office and pretty much being told, here's your laptop, all training will be done at home. Good luck.
Right. Well, I bet a lot of our clients can relate to that because from what we've heard, many of them decided to shut down around the same time. Either it was, late spring or getting close to mid-April when the lockdowns went into full effect there. But so you're based out of our Louisville office, which as
Correct.
Adam often says is a better building than the new one that we have in Canton. I haven't been down there to check it out, but how is it down there? Is it as nice as he says?
Yeah, it is a very gorgeous office. The very first office I know, I was in there twice, and this one is probably about 10 times the size of the last office that was here in Louisville.
Oh, wow.
It's a gorgeous office. It's, I think I want to say around 60 people, but on obviously right now with the environment in which we're all working in, we have about, on average, I'd say at least 5 people here a day. We have space in which we can social distance and work while being in the office here.
Awesome. Well, I'm a bit jealous because I've only been to our new office a few times, and we have that new office in Canton that we opened up as our new headquarters. And
Yep.
Unfortunately, it's been difficult to be in that office. But hopefully next year things will go back to normal at some point. We have, vaccines are out, things are good. And the topic we have today, we want to talk about a hot topic that's COVID related. Before we jump into it, I want to learn a little bit more about what you did, Mitch, in your previous life at a company familiar to us and many of our clients called Equian, because you were there for a long time. So why don't you talk a little bit about what you did there and what your experience was like?
Yes, sir. So I was with Equian for 11 years, began in their customer service department, short stint there. But then I worked as a claims examiner and team leader for 8 years in the subrogation department, working with a client out based in Northern California, Kaiser, a pretty large health group. And then from there, the last 3 years prior to coming to Phia, I was a supervisor. We did provider billing for physicians, and we collected on their behalf when it came to, say, auto accidents, property accidents, something of that nature where somebody else was at fault and we were trying to collect payment on behalf of providers.
Great, yeah, and that's a big part, obviously, of what Phia does as well in our subrogation division, which really has expanded over the last few years in particular, which is why we have an office down there in Louisville. So that's great. I know there's been a hit to sort of the entire healthcare industry because of what's gone on with COVID. That's especially true when it comes to subrogation. On the one hand, it's a good thing. You have less accidents happening, like less people getting injured, but you also have, the impact down the line to people that, are delaying getting care that they may need. People are not getting diagnosed for conditions they may have. There's all kinds of problems going on. And from my perch in consulting with our team of attorneys, we're looking at plan language, we're looking at the regulations and the different laws coming out and making sure that we're protecting our clients as best as we can. But one area where we don't have a lot of protection, unfortunately, even despite attempts by Congress, is when it comes to surprise billing. And so oddly enough, one of the topics that you picked, Mitch, today was about surprise billing. And when it comes to COVID, despite the attempts by Congress and regulators to make sure that people are not getting balanced bills during the pandemic, of course, they still are. And that's especially true when it comes to actual COVID testing and treatment. So you'd think that, getting a COVID test, you shouldn't be getting balance billed, right? Well, it turns out that there's actually a number of loopholes in the CARES Act, which was the primary law that was passed earlier this year to really get funding provided to states and to require insurance companies to cover COVID testing. But one of the keys that we see in PGC and consulting is that if you're getting a test and it's not medically necessary, so if you're traveling somewhere and you want to get it done, if your employer requires you to get a test, if you go out of network to get that test, like many people do, then you're likely to see balance billing related to that test because, you didn't need to get that test done from a medical standpoint, right? You elected to get it in order to travel somewhere or your job may have required it. And similarly, when you're at a physician's office or some outpatient facility getting a test, oftentimes they run a number of other tests because before they suspect it may be COVID, they may think you have some other kind of ailment or condition. And we've seen provider offices run, 4, 5, 6 tests all at one time. And in those cases, right, then you're getting slapped with a balance bill after the treatment. And so there's a huge issue with that because obviously we want people to get tested. And, we also want these out-of-network providers to be charging a fair amount because the plans in these cases, of course, are paying something, right, for these out-of-network services. But all the provider has to do based on the legislation is post the price of their COVID test, at the facility. But there's very little control over what they'll have to pay. And before I talk about a similar issue with vaccines and how there could be some gaps there, I guess, Mitch, why don't you give us some of what you've seen in provider relations in terms of balance billing? Even if it's not COVID related, it's still a big problem for people that are experiencing that during the pandemic, right?
Absolutely. See it on a daily basis. The biggest thing, if you are seeking medical treatment and know that you have to seek medical treatment, always research where you are covered and where you're not covered. I see this all the time. You go to a hospital that's in network. That's great. Your hospital, your facility charge might be covered, but guess what? Some of those independent providers, such as anesthesiologists, independent physicians that are not in network. So a lot of times these things are hidden and you will not directly know that information unless you actually ask. Ask before you seek your treatment. Hey, where am I covered? Where am I not covered? Which groups are in my network? Which groups are out of network? This is the biggest problem I see. Obviously, they're going to freak out. You get a bill, thousands of dollars. Okay, well, I thought I was covered. I talk to these patients weekly. They sit there, they tell me, well, no, this is all covered under my insurance. And I have to explain to them, unfortunately, this particular provider was out of your network. And ultimately, you bear the burden of the remaining balance of the bill. Your self-insured ERISA plan paid what they're legally and contracted to pay. And now, unfortunately, you're the one left with the balance. So that is the biggest thing I see. Research, understand your deductibles and copays. Also, when you are picking your insurance, make sure that you pick a plan that works better for you and caters to your needs and what you think you may need in the future when it comes to your medical treatment.
Yeah, and I'm glad you mentioned that, Mitch, because it really kind of goes back to patient education and, us in the industry, what we call employee education, right? So letting your employees know what to ask, what questions to ask, so that they are informed about the difference between in-network and out-of-network providers. Even when you're in the same facility, like you said, you could be seeing one provider who's out of network within the in-network facility, which is very confusing. And of course, knowing that with ERISA plans, the number of state laws out there that ban balance billing don't apply to those plans. And so the plan's going to pay what it's contractually obligated to pay. The provider doesn't really care about that because they're going to seek the balance from the patient. And so, it's important to remember that despite the ongoing pandemic and, the economic sort of catastrophe that's gone with it, people are still seeing these balance bills on a regular basis. And as I mentioned, it's even extending into the realm of COVID treatment itself. At least when it comes to vaccines, though, some good news is that there shouldn't be a lot of balance billing or any balance billing associated with vaccines at all because of the CARES Act, the way it's worded, and sort of extra agency guidance that has come out saying that providers can't balance bill patients for the cost of the vaccine. And before you say, well, that just means that plans are going to pay more money, that might be true. But it looks like from what we've seen early on that the pricing data for the vaccines is actually relatively low in terms of the amount compared to what we feared it might be. I think what's gone on is the companies that have been approved, they know that they're not going to try to price gouge, anything like that right away, at least when it comes to the cost of the vaccine. It looks like it's on par kind of with what the flu vaccine would typically cost. And so providers really don't have the opportunity to try and, gouge plans or patients at the outset. But in the meantime, for all other services that people have done throughout the year, if they can even get them done, including treatment that's related to COVID-19, those things are not protected. And providers will often, send their large bills to patients who will freak out and say, what do I do? And that's also where, Phia and others have had solutions. But for us in our provider relations team, we can help with those out-of-network bills. We have helped with very large bills, and we have a team of lawyers and consultants who, deal with negotiations with providers, who in many cases in this environment are looking to settle their claims as well. So I think, there is a ray of hope there. I think we're headed in the right direction. But I think, Mitch, what you said, the advice is really good. If you go anywhere, right, ask questions. I would say, even if you can, get something in writing that documents whether or not someone's in network or not, and have your questions answered all up front as much as you can, because, that's going to be the best way to protect yourself at the end of the day. And if you can't, then, that's why people like us exist, to help patients and plans to fight back against, in some cases, these practices by providers where they're looking to really trap people out of network. In some cases, we've seen that. Any parting thoughts, any rays of hope that you see on your end, Mitch, in terms of what to expect maybe next year or anything as we get through this pandemic?
One additional thing that I kind of left my mind before I went on about researching is also when you get your bill, check your bill and be sure that everything is correct. That is one of the biggest problems in the health insurance industry. Up to 80% of bills contain errors. The last thing you want to do is get a bill, immediately pay it. First thing you want to do is, once you get a bill, if something doesn't seem right, ask questions on that as well. Because a lot of times there'll be charges or treatments on there that you did not actually receive. So be sure you check your bill. For 2021, what I would do is make sure you teach yourself as much as you can in regards to the services that you potentially are going to have. Because balance billing, I don't see it going away anytime soon, even though there's Congress and certain things out there that are trying to prevent it. Providers are going to need those funds as well.
See, I think that's exactly right, Mitch, because, one thing you mentioned about finding errors on bills, absolutely true. Providers are not going to be extra careful when constructing their bills. And so, like you said, oftentimes you'll see duplicate charges or an error in the billing code itself. And sometimes those errors actually add up. And a lot of employers, if they're listening to our podcasts or our webinars, will know that it's smart to have incentive programs built into your plan to incentivize your employees to look at their bills and to find errors and to give them a percentage of the savings, because it's actually worth it. Because like you said, this happens so frequently. And the last thing I'll say, you mentioned, Congress is out there trying to do something. They don't really have much success in a lot of areas, frankly, lately. But it is the case that in the last week, there was an act that we got the text of called the No Surprises Act, which does apparently address some parts of balance billing. We'll be tracking it pretty closely along with other players in the industry, including Phia. But I think this bill is focused more on surprise billing, which is different, of course, from balance billing, which is much more broad because, it really depends on who's defining what a surprise bill actually is. But you're right, Mitch, that, we don't know next year what it'll bring. We know that providers are under a lot of stress and they're not going to let up in their billing, and, and they're not in any hurry to tell people whether or not they're in network, because they want to get the maximum reimbursement that they can for them as well. But no matter what's in store for 2021, you're going to have us as a partner to help you get through it. And we're going to be happy to put on some more of these Faces of Phia type podcasts where we'll explore a hot topic in the industry. We'll bring you someone new from the company to talk about their background and hopefully have a good time along the way doing it. So for all of us at the Phia Group, on behalf of myself and Mitch and our producer, Pat the Man Santos, I want to thank you again for tuning in to an episode of the Empowering Plans podcast. Thanks.